So this is a video on oral hygiene instructions that we do for every patient. This is a DA video. Okay, so we will start by asking the patient, so do you use an electric or manual toothbrush? And they'll say either one. Okay, so usually you can brush just as well with an electric or a manual toothbrush, but it takes a bit more effort to brush with a manual toothbrush versus an electric toothbrush. So when we look at the teeth, there are 5 surfaces to a teeth: 1, 2, 3, 4, and 5. So where we're trying to clean in the mouth is this little space between the tooth and the gum. So it's this little space here between the tooth and the gum. It's equivalent to this space underneath my fingernail where like things get really trapped. You can see here, dirty stuff falls into this space between the tooth and the gum and get trapped as well. Okay, so it's really, really important to keep this space nice and clean, because if things get trapped, the gums will get red and inflamed and pull away from the dirty stuff, fall deeper, pull away more, and eventually the teeth will get loose, and that's called gum disease or periodontal disease. Okay, so we need to angle the toothbrush into this space. How do we do that? With a manual toothbrush, they say it's a 45-degree angle. Like if you're looking at, this is 90 degrees, this is 45. So with a manual, we do little circles in one spot and then we sweep. Then we lift to the next spot, little circles in one spot, then we sweep. With an electric toothbrush, you just press. There's different settings on an electric toothbrush. Generally, we recommend to go to the gentler setting. So if you have 2 buttons, press the second button and then you'll hear it go more gentle, okay? Put it here, let it vibrate, and then sweep up. Let it vibrate, and then sweep up. This is a fancier toothbrush. When you do it the right pressure, it goes green, okay? But sometimes the electric toothbrushes only tell you when you're pressing too hard. It only goes from normal to red. So don't press until it's red. It means that you're pressing too hard. Top, you can scrub backwards and forwards. Inside, again, 45 degrees. Let it vibrate, and then sweep, okay? Like this. With a manual, you do have to like circle and then sweep, circle and then sweep. With your electric toothbrush, if it only has 1 button, sometimes you just need to press it twice, and the second time you press the big button, it will go gentler. Always make sure you use a sensitive or gum care toothbrush head, because we don't want anything that is too rough that will hurt the gums or the teeth. It's not how hard you brush, it's how long you brush for. You must brush for 2 minutes at least twice a day. So people with gum infection, we recommend that they do brush after every meal at least 3 times a day, and also if they've just had their teeth cleaned, after every time they put anything in their mouth, so like a coffee, a biscuit, anything like that. So the bottom teeth, you face down towards that space. The top teeth, you face up. Okay, so again, aim towards the tooth gum margin, let it vibrate, and then sweep down. Let it vibrate, then sweep down. So you're lifting, you're not like doing this, okay? So let it vibrate, sweep, lift. Let it vibrate, sweep, lift. Top, you can scrub, and then inside's the same. Go towards the gums, and then sweep like this, okay? And then this electric toothbrush is a bit fancier. It will go zzz at every quarter, which means every 30 seconds it vibrates once, and it's counting down for you, okay? For some toothbrushes, it only goes zzz once at 2 minutes, okay? So if you haven't brushed until it goes zzz, it means you haven't brushed for 2 minutes. So did you hear that? So it just vibrated. So just go, if it hasn't zzz for 2 minutes and you finish, that means you haven't brushed for 2 minutes. So start again until it vibrates at 2 minutes. So that's brushing. After you've flossed, you've brushed, and then you've rinsed, brush your tongue. So your tongue is here, brush your tongue, because there's lots of little tiny finger-like projections on your tongue. So make sure that all those finger-like projections are brushed and everything is nice and clean, okay? You don't need toothpaste for your tongue, okay? Just make sure you do brush your tongue once a day. So you should floss first, then brush your tongue. When we floss, we go in between here. These are the flossing sticks. We go in, so not soaring, up and down towards your nose. So back tooth, up and down, front tooth, up and down and out. 40% of all of the teeth surface areas are in the gaps between your teeth. So if you never floss, you're not cleaning half of all your teeth, okay? So every single gap once a day. Hold the model for me. So this is flossing with the flossing stick. If we're going to use the normal floss to floss, then how we floss is we get a decent size length of floss like this. We wrap it around our 2 middle fingers or our 2 rude fingers. Use your thumb and your second finger to go in. So we go in, wrap it around one tooth, go up and down, wrap it around the other tooth to try and clean the maximum surface area, go up and down, and then out. So every gap, you're cleaning the back tooth and the front tooth, okay? For the patients that have bigger spaces between their teeth, then we also recommend the interproximal brushes like this, okay? So we are not recommending this instead of floss, we're recommending this in addition to floss. Okay, so we go in and then we we brush in the triangular space in between the teeth like this, okay? Then we rinse the brush, then we can do it to the next bigger space. We're not trying to force a big brush into a too smaller space because that will damage the gums. So it's just for the patients that have bigger spaces between their teeth, okay? Yep, that's it.